Welcome back. While we are learning to live with COVID-19, concerns about the measles cases on the rise in South Africa are growing. Two more provinces, the North West province and Gauteng, have declared outbreaks this month after outbreaks were declared in Limpopo and in Mpumalanga earlier. The National Institute for Communicable Diseases says that 137 cases have been confirmed since the declaration of the first outbreak in October. We speak to the Department of Health Spokesperson Foster Mohale now. Mr. Mohale, thank you for being with us. It doesn't sound like a lot, less than 140, but I guess these are lab-confirmed cases, and we're always worried when things like measles diseases spread very quickly.
Yeah, definitely. Even though the number sounds small, but remember that even COVID-19 started with a few cases like measles and other pandemics. We are not going to wait or relax as the Department of Health, working closely with a number of stakeholders. We are going to immediately try to intervene. That's why we have deployed the teams to all the affected provinces, particularly Limpopo, which is the hardest hit province, with all the districts in the province of Limpopo. Currently, they've got the outbreak of this measles disease.
Have there been any fatalities or serious cases?
So far, we have not reported any fatalities. It was only out of that number, only 2 were admitted, but they didn't stay longer in the hospital. They were discharged a few days after admission. So, but what we have observed as the department is that majority of the cases or patients, they've got no vaccination history, meaning that we cannot confirm whether they're vaccinated or not. So hence we want to encourage all the parents and the guardians to say, if they've got the children who have missed either the first or the second dose of immunization against measles, they must take their kids to the nearest health facility or the clinic in order to ensure that they are up to date with the vaccination status. Because we know that the majority of those who could not vaccinate, it was precisely because of the impact of COVID-19, as most people, they were afraid to go out to public spaces in fear of contracting COVID-19.
If I remember correctly, you get this vaccination when you're under 1 year old, so it's when children are very young. And is the case that if you have received the vaccination, you are usually reasonably protected?
At least you have got some level of protection, but that does not mean you are 100% protected. But at least you will develop some form of immunity, just like other conditions like COVID-19. So hence, we want to encourage to say, even if you are vaccinated, that does not mean you must try to be reckless, try to protect yourself at all costs. So if you know that some of the kids that your kids, as the parents, we know that some of the kids that are playing together with our own kids, they are not vaccinated. We need to urge their parents to ensure that they are up to date with vaccination, because one child can vaccinate a number of children, those who are vaccinated or not vaccinated. But the good thing is that if you are vaccinated, you happen to contract this measles, at least you'll have a little complications, as unlike those who are completely not vaccinated.
And it is understood that poor children are at risk. Being malnourished makes it much harder on your body. Is that a real concern in a country like South Africa?
Yeah, with the level of poverty in South Africa, yes, a number of children were staying in the rural areas, those who are staying in former settlement. The impact of malnutrition has got serious dire consequences if you happen to contract this condition. So hence we are taking the services to all these areas, especially those who are staying far from their nearest health facility or the clinic. So we are working with a number of institutions through what we call the mobile clinics to take the services closer to where they are. We are also working closely with a number of community-based stakeholders like your traditional leaders, your religious leaders, so that they can be able to open and assist us to preach the word of mouth, to encourage their members to take their kids to our places where we render the services.
So any more advice? So you've said the vaccination is really important, take your kids. What about the elderly? Pregnant women shouldn't be getting measles as well?
Yeah, no, our target so far, we are targeting, because otherwise every person is supposed to should have received their first and second dose while they were aged between 1 and 5. But for now, our target audience is those who are younger, who fall within that age group, because those are the ones who are more vulnerable than the adult ones. But of course, those mothers who are pregnant also, they also form part of our target audience. But the primary target audience at this time is those who are in that group of 1 to 5 years old.
Mr. Mohale, before you go, the Minister was briefing the media about various issues, really talking about paramedics being available this festive season. But he spoke about something else that I'd like to touch on. COVID-19, so we spoke to an expert earlier this week who said people are dying on a par with flu. It's still there, but it's really manageable right now. But we know that when load shedding hits, that's where the problem lies, and people are dying because equipment is not available for them. The Minister said that there's been an exemption for all the Eskom-supplied hospitals, but otherwise you're working with COGTA to look at the hospitals that fall under municipalities. Why is that still ongoing? Given the fact that people die, why is this problem not fixed across South Africa already?
Yeah, look, what we cannot confirm is that we have not received any report of somebody who lost his or her own life precisely because of load shedding in our health facilities. But the bottom line is that the blackouts have got a serious impact on the provision of health services, even though uninterrupted power systems in the form of batteries. Yes, we've been engaging with the COGTA because we've realized that the majority of hospitals which are receiving their electricity directly from municipalities, there's some delays, unlike those who are receiving directly from Eskom, because we've been working well with Eskom. Now we felt that we also need to bring COGTA to assist to facilitate those municipalities in order to ensure that they exempt those facilities in their areas.
But when will all hospitals be exempt? Very quickly, because we have heard from experts that people are losing their lives.
Yeah, no, look, this is a work in progress. We come across a number of technical challenges that for us to overcome, we'll need to have enough budget. For example, during the preliminary assessment by Eskom in attempts to exempt our hospitals, they found that about 46 hospitals across the country, for them to be exempted, as government will need to pop up around 350 million rand in order for Eskom to develop, to construct a completely new infrastructure, because majority of our hospitals are embedded in the system with the rest of Eskom or municipality clients, which makes it difficult to immediately exempt them from the rest of the clients. Otherwise, if they have to exempt them, it means they must exempt the entire community, which is going to defeat the objective of Eskom in terms of saving the energy.
All right, thank you very much. That was the Department of Health Spokesperson, Foster Mohale.